Another thing people are concerned about is oral cancer, and we're very concerned about it too. Of all the different cancers, oral cancer is one of the ones that hasn't really gotten any better through the years. We've been doing so much research and spending so much money that a lot of cancers have gotten drastically better, and our recovery rates are drastically better. Oral cancer over the last 20 or 30 years has stayed about exactly the same. We're getting just as many cases, and we're getting just as many deaths from it, which is fairly sad. One of the things we do here at our office is check each time you have your teeth cleaned, we check you for oral cancer. And then we have another advanced test that's an optional test that we give, where you would rinse out with a material that's a citric acid mouth rinse, which would be about like drinking pickle juice. And then once you do that, we turn out the lights and use a special light to look in your mouth. And if there is anything changing in your mouth, that special light is going to make the tissues show up different. It doesn't tell us that that's a cancer yet, but it tells us that something is going on, so that area could be checked more closely to see if there's a problem with cancer. One of the things that would cause an increase in cancer in your mouth would be tobacco use, either smoking or else dip or snuff or chewing tobacco. About 70-some% of the cases are going to come from that type of thing. But there are other factors involved, hereditary factors. If your mother or grandmother or father had a problem with oral cancer, you could actually inherit it. And some younger people are getting some oral cancers now involved in different viruses. So there's also viruses that cause oral cancer too. So there's a lot to be concerned about there, and that's one of the major emphasis we have at our office.